Jonathan Lemire, Donald Trump is on the move today, moving around all the people that it takes to shift him from location to location. And that White House has had some outbreaks. What do those movements entail? And is he still defending what he says to be doing, which is taking hydroxychloroquine, a drug the FDA cautioned could be deadly?
He is very much defending his decision to use hydroxychloroquine, Nicole. The president was on the move today. He went over to the Capitol, had lunch with Senate Republicans to talk about a number of topics, including potentially another economic relief package. But that's not the headline today. The headline is indeed his defense of using this anti-malarial drug. He said today that it was a personal decision. He again touted its possible benefits. He dismissed, in fact, the fact that a number of medical experts have really issued rather stern warnings about using it, if not carefully administered in a hospital setting. There is a real concern on both sides of the aisle, actually, that the president's use of this could inspire Americans to perhaps do so the same also, and not as safely. That is something people are worried about. The example this president is setting, he's never quite been one to recognize that his role as president is sort of national role model. And we can go through a long list of examples on that, I would think, Nicole. But he said today, in fact, he downplayed some of the research on this. It, in fact, was very dismissive of a study, a VA study, that said that when this drug was administered to patients there, that a lot of patients had rather adverse responses to it. And he declared it to be a, quote, Trump enemy statement, whatever that means, but suggesting again, Nicole, that if there's ever a piece of news that the president disagrees with or he thinks makes him look bad, it can't be seen as fact, but rather he has to dismiss it as an attempt to deliberately demean and denigrate him. So yes, he is absolutely showing no remorse for using this drug, which he says he's been using for over a week now. He says he'll continue to use it. And now the question is, who else is using it? The vice president said today he wasn't, but I think there's going to be a lot of questions right now about what other West Wing officials might be using it, and are they going to feel pressure from the president to do the same?
Dr. Wen, let's listen to that attack on what Donald Trump described as an enemy, but was, as Jonathan just said, a Veterans Affairs study, not anything that Trump has called an enemy before. Let's watch it and see if we can figure out what he's talking about.
Why is it okay for you to promote the use of this drug when you're not a doctor and health experts are warning?
Well, I've worked with doctors, and if you look at the one survey, the only bad survey, they were giving it to people that were in very bad shape. They were very old, almost dead. It was a Trump enemy statement.
I'm going to leave for AB the idea that he's describing people in the Veterans Affairs healthcare system, who are people who have served this country in the military, as almost dead. But Dr. Wen, can you address what this study was, what the facts are about hydroxychloroquine, and why the president would be taking it?
Well, Nicole, we need to look at the facts, the data, and that's what I do as a scientist and as a doctor. And right now, there is no evidence that points to hydroxychloroquine being an effective treatment if you have COVID-19 or as effective prophylaxis to prevent you from getting COVID-19. I mean, there are a number of studies that are being done, a number of clinical trials that are being done. Hydroxychloroquine is one of the medications that's being studied, but so far the results are at best mixed. At worst, they are negative against hydroxychloroquine, saying that the risks outweigh the benefits of taking this medication. And frankly, I'm worried for President Trump. I mean, I'm glad that he's under good medical care. He has people around him in case he does experience side effects. One of the side effects is cardiac arrhythmias that could result in death. Well, he has really good medical care. And if he, God forbid, should have a bad event, there are people around him who can resuscitate him. But what about all those other people watching him, listening to him, who now want to get this medication? They may not have that type of solid medical care around them. And I just worry about the message that it sends to the rest of the country. And I also worry, Nicole, about, you were saying, why is he taking this medication? Well, one hypothesis is that he's taking it because of the high-risk exposures that he had, his personal valet, the other aides in the White House who tested positive. But if they tested positive, shouldn't he be quarantining? Shouldn't he be staying away from other people instead of taking this unproven medication?
Dr. Wen, I want to ask you, I don't want to put you on the spot, but you may feel that way when I ask you this question. Do you think that the pattern of the president's doctor before he was president was Dr. Bornstein? His office was, I think, raided at some point. He put out a fantastical health report about Trump, calling him basically a specimen, the finest specimen he'd ever seen. And then Dr. Ronnie Jackson, who's now running for something, who's turned into the Trumpiest of Trumpy conspiracy theorists. He, said his weight was something, I don't know, like akin to a professional basketball player's weight. Just if you have eyes, you knew it wasn't the truth. And now we have this really muddy letter. I mean, the doctor didn't really confirm he was taking it. The press shop did. And do you think we even know the current health of our president?
Well, I don't know. And I will say that medical care is complicated. That relationship between doctor and patient is complicated. Every doctor, we've all had patients who've come in and have wanted a particular treatment that we don't think is necessary or is even bad for them. And it's our job to take into consideration their preferences, but also it's our job to give the best medical advice. But the best medical advice includes sometimes telling the patient that what they want is just not possible, and that we all should be following the best available evidence, because that is what's best for their health too. And I hope that those are the conversations that are also happening with President Trump and his doctors.
Okay, AB, I wanted you to dive into what my cable neighbor, Neil Cavuto, said, which was really powerful. I mean, he was speaking directly to his viewers who may be considering doing something Trump's doing and telling them, don't do it. Don't do it. It could kill you. And it was about taking hydroxychloroquine. It invoked rage from the president, who started tweeting longingly about Roger Ailes. Not so surprising, but the bigger structural problem for the president seems to be that he's opened up a fissure at Fox News at a time when he really needs that whole network rowing in his direction.
Well, look, I mean, Neil understands that our own FDA has said that this is only supposed to be taken either in a hospital setting under the care of a physician, or if you are taking it for the clinical trials. The president dismissed it today as not too good, he guesses, for people who were veterans chosen as guinea pigs for a study of this when they were already quite sick. He wrote them off, as you previously noted, as really old and almost dead. And so they didn't have a good response. But Neil Cavuto, who has been forced into the most unbelievable health crises any human being could ask for and overcome them, knows a lot about people having underlying conditions and how dangerous this could be. Not if you have malaria. And by the way, we're going to run into shortages, which people have been warning about, like Dr. Wen, for months, for people who have lupus and actually need this to help them. If you have COVID, and there is no evidence that it helps preventatively, if you have COVID and you go into mass organ inflammation and potential multi-organ failure, it is too dangerous to take this drug. And so that's why, people like Neil Cavuto are not alone. They're going to be running around, and the FDA had to say again today, this isn't true. I actually, Nicole, am not so certain the president is even on this. His doctor's note yesterday did not say he prescribed it because he could get in trouble for doing so legally. And he did not say the president was on it. He said they discussed it. I think the president when asked questions about people who don't respond well to it, he rebuts that. But I think he's interested in finding hope for people, that there always is treatment around the corner. And he even dismisses vaccines as he knows they're too long off. With or without a vaccine, he said a few days ago, we're open, for business. And so he's trying to convince people there's always another magical cure around the corner. And hydroxychloroquine is his favorite one. It doesn't matter what public health official or journalist at Fox News or anywhere else tells him about this study or that, or the FDA's warning from his own government. He is latched onto this. And whether he's taking it or not, I think he's going to continue to promise it as a panacea no matter what.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.